Hello and welcome to Live Healthy West Virginia, the podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. October is Breast Cancer Awareness Month, and it's estimated that 1 in 8 women in the U.S. will face a breast cancer diagnosis in their lifetime. Many of those patients will face undergo breast surgery and/or radiation therapy, which can cause painful side effects that can limit range of motion. The good news is breast cancer recovery rates are increasing, and rehabilitation, such as physical therapy, is playing a role in that journey. So today, we're talking about strength after breast cancer treatment with rehabilitation with Dr. Megan Clark, physical medicine and rehabilitation specialist at the WVU Cancer Institute. Welcome, Dr. Clark, to Live Healthy West Virginia.
Thank you. Happy to be here.
So good to have you here. So when we think of physical therapy, we think usually about treating for joint pain or injuries, but not so much for breast cancer. So how does rehabilitation play a role in recovery during and after breast cancer treatment?
It's so true. Most people's experience with physical therapy has come after sports injuries or accidents and broken bones and twisted knees. But for us, we're looking more at that rehabilitation also for joints and muscles and nerves, because just because the injury looks different doesn't mean that the function is any different for those patients or that the symptoms aren't the same and that they're limited in the activities that they used to be able to do or want to be able to do. And so the goal of rehab in cancer is still returning them to their life, getting them back to activity and back to function again.
Well, that makes sense. Is this a relatively new treatment?
So the treatment itself isn't new. A lot of the docs in rehab who have been seeing patients with these impairments would say they've been doing it for decades. But I think that the recognition of the importance of it has continued to increase. So we know now that movement and exercise is vital for all of us, but especially for people who have illnesses and sicknesses. Can we get better response to treatment if people are exercising? Can we get better recovery? Do people go to the hospital less often if they have that baseline functional status that's a little bit higher, a little more exercise endurance? And so we're really seeing that improvement when we incorporate movement, rehabilitation, therapy into a patient's treatment plan to get them recovering faster and better.
So are there exercises outside of a rehabilitation plan that breast cancer patients should do, like, walking?
Walking is wonderful. At the end of the day, movement is the name of the game. And however people want to move and whatever movement seems the most fun for people, that's the best answer. There isn't any special routine or special equipment that is somehow giving people better results than something else. So There isn't anything wild or crazy out there that's the magic answer, unfortunately. But fortunately, that means that whatever people used to do or enjoy works just as well. So we find that if people can walk and be active 30, 45 minutes a day, we're seeing those same benefits and same results as swimming, as jogging, as rowing, as kayaking, whatever people want to do and enjoy. It's the movement and it's just going out and having fun.
Well, walking seems to be good for everything. I've never heard, well, whatever you do, don't walk.
Exactly right.
Okay. Who is a good candidate for physical therapy during or after breast cancer treatment?
Everyone. We all need to move. We all are having some part of that diagnosis or injury that is going to affect people. And just because it doesn't knock people down totally, doesn't mean that they haven't been impacted in what they're able to do. It's the young mother who has children at home, is trying to work, is still trying to be a spouse or a daughter or a friend, and just isn't able to fill those roles as well as she used to be able to feel. She's still doing, because she's resourceful and has just some sort of deep energy that pushes her, but it doesn't mean that she couldn't use a little help and a little extra boost to get back to those activities. So one end of the spectrum, we see the people that don't have an impairment, or there's not something that they feel like is particularly wrong with them, but they're still not where they want to be. On the other end of the spectrum, people have actual injuries that can come from any of this, and that they're limited in how they're using their arm or their shoulder. They can't reach above their head, or they've got increased pain. And so for those things, definitely there are focused treatments that we can use to help with those impairments. But there's a lot of in between and all of that, and everyone can benefit from some sort of intervention and helping them get moving again.
So it's good for everybody.
All of us.
Excellent. Good to know. What kind of therapy interventions or exercises are used to treat the side effects of breast cancer?
So a lot of that can be individualized to the person and kind of where they're starting out, individualized based on what their goals are and what they're wanting to achieve after treatment and returning to life, individualized based on what the treatment or surgery is or is planning to be. Sometimes we'll do things as a sort of preemptive strike to try to strengthen them before the surgery that we know is going to weaken their shoulder or weaken their core. So can we build that up to try to reduce their recovery time after those treatments or after that surgery? So a lot of that can be individualized based on what the patient needs.
Okay. Do most health insurances cover rehabilitation like this?
Yes. So either, physician visits, and if I see people and I talk with women about, what their needs are and coming up with a treatment plan for them individually, but also for those more focused and intensive physical therapy options, yes, those are covered by most insurance plans, and most coverages will be able to take care of those treatments.
So it sounds like is this becoming a standard part of care? I mean, it's part of, just like radiation therapy or, any other, this is part of the plan, right?
Yes, that's the goal. And that's what we find it should be, because it really is a lot of times the important part to patient after we get them through all of this treatment. Where are we leaving them? Just like you said, we're getting better and better at curing this cancer. We're getting better and better at making sure that women are surviving this diagnosis and they are surviving their treatment. But then what? So breast cancer really becomes a chronic medical condition, right? Like anything else that we collect along the way, this becomes a chronic condition that we want to limit the side effects of forever after.
Okay, good to know. Talk about a little bit about the physical therapy team at the WVU Cancer Institute.
We are very lucky to have specialists in this area that are here and on our team and working with our patients. Like you had mentioned earlier, while cancer rehab isn't new in its essence and what we're doing, the naming and the focus of it is becoming more prevalent. And so we're really specializing in our cancer patients, understanding their diagnosis better, understanding their treatments better, working with their teams, with their other doctors, to be able to provide the best care and integrated care for them. So on our team and our staff, we have physical therapists who are specialized in oncology. We are very fortunate even to have an oncology therapy fellowship here at WVU, which is one of only a handful in the country. So
Wow.
We are very well versed in this. We are very specialized and lucky to have the professionals that do it.
Well, I imagine, because the physical therapy or rehab would be different than if you had a knee replacement.
It is.
Mhm.
It is.
How's it different?
The human body is the human body, right? If
Right.
something is broken, we're still evaluating and treating those broken pieces, but having that knowledge of why and a knowledge of what someone else is going to be going through can sometimes allow us to better understand the injury and predict a little bit of what needs to be focused on so that we can really kind of shorten the recovery time is the hope.
Yeah.
Identify better and shorten that recovery time for the patient.
Okay. Now you were talking about the depth of experience of the physical therapy team, but why should patients go to the WVU Cancer Institute for treatment as opposed to going somewhere else?
We have gotten better and better at treating cancers across the board. And you can get a regimen for chemotherapies that's pretty standardized across the board. But just like you had mentioned earlier, it's not just the chemotherapy alone. It's not just the radiation alone. It's being able to look at the patient as a whole package and really being able to care for that individual. And so establishing the team here with all of those specialized parts allows us to better care for the whole person. So it's important, not just for the cancer itself, but for the person that they get that individualized care.
Sure. And I imagine the depth of experience of the whole team, not just the rehab team, is just phenomenal.
Well, obviously I am biased in that I love being able to work with a team that's that amazing and that,
or you wouldn't
that
be
dedicated.
Here.
Yes, I love that opportunity to be able to work in a team just for myself and for my own bias. But I know that that makes a better experience for the patient when we're all collaborative and are able to work together.
And that's what it's all about.
It is.
Yeah. So before we go, I always like to ask, what's the most important thing you want our viewers and listeners to know about rehabilitation for breast cancer?
Move in any way, shape, or form they can move and keep moving. But know that there are resources here at WVU to either help them get started, show them direction, being able to encourage or cheerlead, because sometimes that's what it takes.
Yeah.
But also to be able to address any of the roadblocks that may come up in their path as they start that journey.
All right. Well, thank you so much for joining us and sharing this information today. We really appreciate it. And I think we helped a lot of people today, too.
I hope so. Thank you.
Thank you. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information on breast cancer, visit wvumedicine.org/cancer. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or on the all-new West Virginia Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Clark and everyone at WVU Medicine, thanks for joining us.